So I welcome team Caregiver Sati with us, who are our partner in presenting this webinar to you today. Ria Chakravarti and Ashwini are the core team from Caregiver Sati. Welcome. Ria, would you like to get this rolling on who or what Caregiver Sati is for the benefit of our participants?
Yes, thank you so much, Jacinta. Firstly, we are thrilled to have collaborated with Just Hospitals for this event. Good evening, everybody. Thank you for joining in today. Quickly, a brief introduction about Caregiver Sati. We are an organization who works specifically focusing on the well-being of caregivers. Our main objective is to help caregivers like you who face a lot of challenges in their caregiving journey and how we can help to ease that journey for you. We try to provide a kind of holistic support, try to build an ecosystem where you can access a lot of support in terms of resources, information on medical conditions, support groups, even one-on-one coaching, counseling. But this is all mostly to help you to deal with your challenges and, because in retrospect, that helps you to take care of your loved one as well. So this is what we are doing. I know that there were a couple of questions on caregiving that we had received as part of the registration. I will urge all of you to join our community because I think that will help you to connect with other caregivers and learn a lot. And through that, we can also connect and get you started with a lot of information that can help you in your journey. So thank you so much. Thank you, Jacinta. I think we can start the session.
Thank you, Ria. I personally, for one, I'm so glad that we have a platform like Caregiver Sati today that actually is built around for and by caregivers themselves, mind you, this entire community. And Ria and Bhavna and her team are doing a phenomenal job in reaching out to all caregivers across India in terms of providing some support and city's guidance. Now over to Jassi Hospitals. Jassi Healthcare Private Limited is a company that has been in operation since mid of 2021. We're operating out of Goa, Delhi, and Bangalore. We have Jassi Hospitals, the co-presenter today, and Jassi Care as the two key initiatives of Jassi Healthcare. So under Jassi Hospitals, we bring India's top surgeons to your town. We take care for your pre-surgery, surgery treatment, and bringing India's top surgeons to a hospital near you. We help serve families, particularly in Tier 2 and Tier 3 cities, for all their surgery needs, second opinions inclusive, and all kinds of health conditions. On the other hand, Jassi Care addresses post-surgery or a post-hospital condition care and rehabilitation needs with medical supervision and at-home recovery services. Coming to our discussion today, seniors or people of any age with underlying medical conditions are at a very high risk of catching infections and at home. If you or I are caring for a loved one at home and worry about infections that can impact their health, today is a very apt talk led none other by our expertise, Dr. Ankita Baidya. She is MBBS, MD AIMS, DM AIMS, ID Training WSU USA. She is a senior physician, infectious diseases, founder and CEO, iCure Clinics, New Delhi. Dr. Ankita, without any further ado, over to you.
Yeah, thank you, Jacinta, for this nice introduction. So basically what we all understand about infectious diseases. So infectious disease management is not just about diagnosing and treating it. It is also important to know how you can prevent it, because infections are actually communicable diseases. So communicable diseases means it can be transferred between people, or you can get it through different sources. So in this presentation, in this discussion, I'm calling it discussion, that it could be an active participation from your side also, that if you want to ask any question, keep your questions ready, because it's not only focusing on slide what I have put, but focus on the words also that I'm telling, and whatever the questions come in your mind, feel free to ask. So I'll just share my PowerPoint presentation now. Just a second. Yeah. Yes.
I'll just take this opportunity. So quickly, we have questions which we can take at the end of the session, but feel free to type in your questions in between so that we can collectively have Dr. Ankita address those. Thank you. Yes, doctor.
So avoid to catch infection at home. So, but this is what the topic of today's discussion is, and I have mentioned about preventing infection is as important as when we come to diagnose it and treat it, because uh, uh, it's a golden word that prevention is better than cure. So in my presentation, I'll be talking about how do we catch infection, what are the actual factors responsible that you get infection, how can you actually work on nutritional and nutritional factors and immunity for improving your capacity to fight against infection, care of bedridden patients, prevention strategies, vaccination. Few people do have pet at their home and they can become a source of infection. So how you can go for proper pet care and what to do in case you are actually having infection. So now this part I'll be talking about little about how we what we can do so that others, actually if somebody is having infection at home, others in the family don't actually get the infection. So infection can be of two types. So as a doctor, we say it's a community acquired infection or a hospital acquired infection. The reason being that we see more of the resistant bugs when the person acquire infection through the community, through a hospital setting. If somebody is staying in hospital and getting a urinary tract infection, for example, the chances of that bacteria that is causing the infection and is more resistant to antibiotics, difficult to treat, prolonged treatment, more side effect and more cost is involved. Community acquired infection, on the other hand, which where you all play a very important role to prevent those infections, are usually acquired through different means. Where it could be through different sources that we are that is there in our day-to-day life, like foodborne infection, waterborne infections, airborne infections. So foodborne infection commonly listed, we say common in common words, food poisoning is there. So food poisoning typically means that the food that you have taken was actually having some sort of infection in it, and after consumption of that food, the person developed acute diarrhea, dysentery, vomiting, bloating of abdomen, abdominal cramps. So this is the common form of foodborne infection. Current setting, we are actually also seeing a lot of enteric fever, that is typhoid cases, typhoid infection. So these foodborne infection can be very well taken care of if you are maintaining a good hygiene and good food eating practices, like especially before having your food, go and wash your hand. Food should be as fresh to consume. Try to avoid outside food. And for the same holds with waterborne infection. Again, it can lead to different sort of infection. Mostly waterborne infections are cholera, diarrhea, dysentery, but there are again typhoid can also be related to waterborne infection. So food and waterborne infection usually have common sort of presentation that we see in community acquired. In normal settings, there are rare infections that can be seen depending upon what kind of food you are eating. Like if somebody is eating non-vegetarian food, it is important that the food is properly cooked, because sometimes what happen, a partially cooked non-vegetarian food can sometimes harbor certain form of parasitic infection, and this can give different form of infections, different form of parasitic infection to the person who is consuming. A very common example of this is cysticercosis. That's a tapeworm infection that we see. So foodborne and waterborne, properly cook your meal properly. Hand hygiene is very important before you are consuming it. Eat food from if you're eating an outside food, at first place, try to avoid eating outside food, but at all, if you are eating an outside food, try to eat it from a hygienic place, and consume food when it is fresh. On the other hand, airborne infection. So a lot of us are talking about mask, airborne infection, flu, COVID. So airborne infections, it's not only different flu viruses or different or the COVID virus. Apart from this, tuberculosis. and fungal spores. These all can cause airborne infection. And fungal spores, if the people around you, any of your family member is asthmatic, so they can have allergy to the fungal spores. So what is recommended, if the such people, patients who are asthmatic on immunosuppressants, because of any reason they are taking some sort of steroids, having a prolonged disease of lung, maybe COPD, like chronic obstructive pulmonary disease, COPD, for which people require inhaler. So you might not understand what a COPD is, but if somebody in your family is requiring inhaler therapy to avoid coughing or to avoid breathlessness, the person is having some sort of obstructive lung disease. So it is important that if they are to avoid fungal infections and also certain form of pneumonia, it is important for such people around you that they should be wearing either they should avoid walking in the park, in the area where a lot of flowers are there, because these are the sources where actual fungal infections, fungal spores are there. And at all, if they are doing it, they should nowadays, because of the COVID, we all are in practice of wearing masks, so just continue wearing your mask. This will filter out the bigger spores, fungal spores, and you will be protected. Again, pollution levels, again, it affects us adversely. So and pollution level, it's not only air pollution that we talk about, it's the water pollution. The water pollution including both organic and inorganic, so different sort type of salts, minerals. If it is dissolved in extra quantity, it can again give rise to diseases, not infectious diseases, but yes, non-communicable diseases are there. Apart from this, air pollution again affect your lungs adversely, make you more prone against lung infections, respiratory tract infection. It sensitizes your immune system like this, that you become more reactive to certain infections in the form of sometimes just allergy to that infectious agent, microorganism, or it could be sometimes actually the true infection causing pneumonia. So community acquired infection, these are the common one that I have listed. Respiratory tract infection could be lower respiratory tract. When it involves your lung, it is lower respiratory tract infection, LRTI. Commonly, you people must have heard about it, LRTI pneumonia. URTI, on the other hand, that is upper respiratory tract infection, involves sinuses, cough and cold usually. So people usually have blocked nose. Rhinitis is a part of URTI. Block nose is there, sore throat, pharyngitis. So these are a part of URTI, community acquired infection. UTI, elderly tends to have elderly female or male also, because of the enlarged prostate. There is some sort of obstructive symptoms in while they're passing urine. The bladder is not emptied properly. So they develop UTI, urinary tract infection. So in elderlies, female, because of hormonal change, postmenopausal, they are susceptible and shorter urethra to UTI. Diabetic again is a subgroup of patients who develop UTI. So what you can do to prevent UTI? So if UTI, so one thing, drinking cranberry juices actually helps in preventing UTI. Taking alkaline water in the form of alkasol. If you are having burning micturition, slight burning in the urine, you can take this and wait for your reports. Meet your doctor and wait for your reports of urine routine and urine culture, whether actually there is a requirement of antibiotic and actually there is infection, or it's just some sort of inflammation in the urinary tract. So you can drinking a lot of water actually wash out whatever bacteria attaches to the urinary tract, the bladder, the urethra. Urethra is the part of the urinary tract from where the urine is excreted out of our body. So urinary tract infection, two things you have to remember: drink plenty of water. If there is no contraindication, there's no as such serious heart problem, or there is no as such kidney problem as such, but because of which your this water intake has been asked to reduce, and you can take a lot of cranberries or cranberry juices. But I know cranberry juices are very sweet, and when I say people who are diabetic to take cranberry juice, so then it becomes actually difficult. So there are cranberry capsules also, available in the market that you can take if somebody is having recurrent UTI. So when we call a person is having recurrent UTI, so recurrent UTI is said when a person is having at least 3 episodes in a year span. So 3 documented episodes of UTI, urine infection, if somebody is having for a year, then it is called recurrent UTI. Now, next important community acquired infection is gastroenteritis, which is commonly called as diarrhea, dysentery. Symptoms are vomiting, loose motions, abdominal cramps in your abdomen while passing stool, or abdominal pain, I can say. So gastroenteritis is again, and it's usually food or waterborne gastroenteritis infection. So the same precaution that I mentioned that you need to follow when you are actually when actually you are eating outside or while consuming food and water, just take all the precautions that they are hygienic, practice your hand hygiene. Skin soft tissue infection could be because of minimal trauma. Diabetes are more prone to get skin soft tissue infection. So what they can do, they should, and what happens in a diabetic person has a weaker nerves. So sometimes even if it is not uh, proven that they have weak, the neuropathy is there. But if I talk about a normal person who's a non-diabetic and a diabetic person, 20 to 30% neuropathy is usually there when they are diabetic since last 10 to 15 years. So in that case, we suggest that you wear a covered shoes, so that a minor trauma, when if it goes unnoticed and somebody is diabetic, fluctuating blood sugar level actually gives a very good culture medium for the bacteria to grow. And what happens, they tend to have diabetic foot, bad infection, and difficult to treat infections in that case. So wear covered shoes, and diabetic can actually avoid diabetic foot, and take care of your blood sugars level and local hygiene. uh, Even a minimal trauma should be addressed properly. If at all come to your notice that there is a minimal trauma, address it carefully, apply a good antiseptic, and if required, consult your doctor. Acute febrile illness, so this is a generic term we call acute febrile illness when it comes to community acquired infection: typhoid, malaria, dengue, UTI. So any fever which is less than 7 days of illness, we call it acute febrile illness. uh, and these are the etiological agents: viral, bacterial, parasitic, fungal. So all these infections can be caused either by a virus, by a bacteria, by a parasite like malaria, fungal infection like aspergillus, candida. So different fungus are there. I'll not go in that detail, but yes, if required, if somebody is there who is suffering from this infection, you want to discuss, I can definitely discuss that. So what are the factors responsible? So we take it in the 3 headings: host factor, environmental factor, and agent factors. So I have already talked about environmental factors, the different pollution level that actually affect us adversely. Now there are some host factors. Host factor in the person, if I talk about individual individual person, so different age, so extreme of ages are more susceptible, whether it's a child or he's an elderly, they are more susceptible to have infection, and in fact difficult to treat infection. Comorbid conditions like diabetes, blood pressure, patients who are kidney patients, patients who are receiving some sort of steroids because of some sort of arthritis, asthma, allergic disorders, or patients who have received some sort of transplant, or rarely cancer patients. So these patients form a different set of patients who are actually taking certain medicines because of which their immunity is less, or actually because of underlying condition itself, the immunity is less. So in that case, they are more susceptible to get certain infections, and it is important that it is prevented. So I'll be talking about subsequently how you can prevent infections, and most important in vaccination in my subsequent slides. Medicines, certain antacids, like people nowadays, I see a lot of enteric fever cases are coming up. So the reason being, see what happens, the bacterial load that is important and required to cause a typhoid infection is almost 10 to the power 5 to 10 to the power 7 colony forming unit per ml. So this is high. But what is happening? People are consuming antacids, proton pump inhibitors like pantoprazole, omeprazole. So what happened? The acidity in the stomach is less, So this acidity is also a natural innate mechanism of, is an innate immune response. So it helps to fight against the bacteria that enters through the food or water. So this acidity is less, so the infective dose of the bacteria is as low as 10 to 100 bacteria per colony forming unit. So it becomes so low. So if the person who is taking antacid and is consuming some food that is contaminated, they are easily prone to get these infections. So acid in stomach, naturally it forms a barrier against infection, but because of the regular consumption of antacid, very commonly seen in elderly, they are actually more prone to get TI infections. Agent factors, different microorganisms. So if it's a resistant infection or a susceptible infection, that is how it actually means. But where we can work into, we can not change the age, we can not change the comorbid conditions, but if it is not required, we can definitely avoid taking antacids. If whenever steroids are required, try to get it in the optimal dose, talk to your doctor, and consume whatever you are consuming, food, water, you take it in a hygienic way. Don't take over-the-counter antibiotics, because actually it promotes development of resistance in microorganisms. Antimicrobial resistance is there, and then somebody starts suffering because to the resistant infection. Nutritional values are actually, when we talk about nutrition, so in COVID era, everybody of us is now well aware how important our own immunity is to fight against infections, including virus infection or any bacterial and COVID-19. So antioxidants play a very important role, because whenever somebody gets infection, there is the type of immunity that actually gets activated and kills the microbacteria, kills the microorganism. It is through the oxidative burst. So oxidative burst, it damages the cells, bacteria, but it in turn also damages your cell also. So antioxidants are very important. And where do you get it? You get it through the natural sources like fruits and vegetables. They are rich in antioxidants. So antioxidant consumption in regular way, taking fruits and vegetables, a good portion of fruits and vegetables in your diet will help you get good amount of antioxidants. Supplements you can take. There are supplements like omega-3 fatty acids, vitamin E, lycopene. These are antioxidants in the form of supplements. So if you think you are not adequately able to consume fruits and vegetables because of the daily activity lifestyle that you are having, you can take these supplements according to your medical prescription. Talk to your doctor and you can take these supplements if it is not contraindicated for you. So these, but I must say, I had seen few people who come to me and is taking antioxidant supplements like 2 years, 3 years, and they're continuously taking it. So it is without consulting their doctor. So it is important to understand that anything in excess is bad. So even if you are supposedly you are consuming a particular combination of multivitamins, antioxidants for a month, try to give it a break for a week or 10 days, and then either you can restart with the same combination or you can switch to another combination after consulting your doctor. So switching between the different combination will help you get different sort of micronutrients that is there, and also will avoid any excess of particular nutrient. If you tend to take it for a very long period, then this can actually make you deficient with certain micronutrients, and there's excess of certain macronutrients in your body. So switch between supplements if you are taking, and include good healthy diet, fruits and vegetables in your diet. So now the care of bedridden patients. So I had also got certain queries regarding care of bedridden patients. So elderly patients who are actually bed bound, few of the patients, they develop bed sore. So what you can do to prevent these bed sores? So first thing, positional change. So how these actually bed sore develop? They develop because they are also called pressure sores. So constant pressure there alter the blood supply in that area, usually you see that these bed sore develop in the bony prominences. So the pressure from the bed above the bony prominences, they actually alter the blood flow in that area, and makes that area also the area becomes moist because of the lack of air circulation, and then it becomes infected. The skin peels off. So this is called, there are different grades of bed sore, grade 1 to grade 4, but grade 1, when it starts, the skin starts peeling off. So initially bed sore is not infected, it's but skin is actually the important barrier against infection. So when it peels off, and if it is not taken care of timely, then there are chances that it can get secondarily infected. So what you can do to prevent bed sore, you have to turn your patient every 2 to 3 hourly to different position. So you can, like if somebody is lying straight, you can, after 2 to 3 hours, you just tilt it, putting a pillow at a side. Then again 3 hours, put another side. So changing position is what is recommended. You can use a water bed or an air bed. So there are mattresses commercially available in which there is circulation of water or circulation of air is happening. So this actually relieves the pressure because of the constant movement of the movement in the mattress there. So this again helps in preventing bed sore. But so positional change, bed sore, and drying, like after sponging the person who is bedridden, make sure the body parts are dry. So you can apply a simple powder or it on it. If you find there is a wet area, you can apply wet, and the skin peeling is there, you can apply Mepilex dressing there. So this will further not progress, and this positional change will help it heal. So Mepilex dressing is again a commercial thing that is available. It's a pink color dressing. Depending upon the site and the size of involvement of the pressure source, you can actually apply those dressing after cleaning that area, making it dry, and you can apply those dressing, and this will actually help in early healing of the bed sore if actually it is there. Diet care is again very important. Usually bedridden patients, it is advised to go for high protein diet. What happens there, that if somebody is bedridden, so the muscle movements are not up to that mark, and what muscle movements are not there, muscle wasting starts happening. So physiotherapy, diet care with high protein diet is recommended. If somebody is taking through bedridden, is not able to swallow, put a nasogastric tube, or you can talk to a doctor. There are different options where enteral nutrition through the normal GI tract, gastrointestinal tract, is what is recommended, rather than going for a parenteral nutrition through IV line. So whatever possible, try to give patient through normal oral tract. So this actually decreases a lot of other problems that can happen if somebody is having IV nutrition than oral nutrition. Salt intake care is again very important. Bedridden patients, sometimes I've seen a lot of patients come with hyponatremia or hypernatremia. So this again should be balanced. You can consult a dietitian also if there is a regular phases where somebody who is bedridden having hyponatremia, then it is important that you put a pinch of salt, or sometimes salt capsules are given, that the salt levels are maintained, because in that case the patient becomes actually very drowsy, dull, if the sodium is less. And if any device is there in situ, that care has to be done. Like if somebody is bedridden and the Foley's catheter, urinary catheter is there, or a IV line is there, or like a tracheostomy tube is there. So that device care is appropriately to be done. Daily cleaning of the site has to be done. Proper suctioning of the tracheostomy tube has to be done. Proper hygiene of the catheter has to be checked. And if any line is there, just try to, if any intravenous line is there, just see that it is the dressing is transparent dressing and there's no redness around that line, and if around that intravenous device. So prevention strategies. So this is very important, and very important for all of us to remember: hand hygiene. So hand hygiene forms the core when we talk about preventing infection. COVID era, flu era, cough etiquette, again, it becomes equally important. Cough etiquette, you need to remember, don't cough in your hand. because hand comes in contact of so many surfaces. You tend to shake hands. But if you don't have a tissue paper where if you are having coughing and you can cover your mouth, you can cough in your sleeves. So this is what is recommended by WHO also. Cough in the sleeves if you don't have a tissue paper or something, or a handkerchief aside. Don't cough in your hand, cough in your sleeve. Like you can just use your elbow like this and cough. So because this surface comes less in contact with the normal surfaces, you don't shake your hand using your elbow, so that you can use it and the transmission of infection is low. But yes, if you have a handkerchief, if you have a tissue paper, use that. And the tissue paper is best because you can throw it in the dustbin after using that. Food and water hygiene, very important. That I have already mentioned. Adult vaccination. Now, this is one of the most ignored aspect in our country, what I can say. Western world, they are aware of adult vaccination. In our country right now, what we say, if we talk about vaccine, if I say somebody, have you taken your proper vaccination as per your age? What the reply I get that, Dr. Saab, 2 doses lag chuki hai. And now they are telling me that booster dose be lag chuki hai. So it is important. It's not only COVID vaccine. COVID um, has created awareness about the role of vaccination in preventing infectious diseases, but there are other good vaccines which are recommended and has successfully been trialed. People are using it in the Western world to protect themselves from different infection based upon the recommendations. So everybody doesn't require all the vaccines, but some people definitely require certain vaccines. So that vaccine recommendations has to be taken on time. There are certain diseases that is prevented, so you can avoid hospital admission, especially for your family members, especially elderlies. Because see, now in the month of July, we know flu is there, flu is coming, and flu will be there in the winters. So flu vaccine are must to be taken, especially people who are diabetic, who are elderly, more than 60 years of age, hypertensive, heart diseases patients. But it doesn't mean the flu vaccine cannot be taken by a 24-year-old gentleman. He can also take that. It is not contraindicated in that age group. It is, but it is absolutely recommended to people who are having a certain illness or who are elderly. But a young person, person can also take this vaccine and prevent himself or herself from getting flu infection, especially in a bad form. Commonly recommended vaccines are currently pneumococcal vaccines, flu vaccines, MMR vaccines, uh, varicella vaccine. If somebody doesn't have a chickenpox infection throughout his life, he can take 2 doses of varicella vaccines 1 month apart and can be prevented against, especially adults. What happens if somebody gets chickenpox in adulthood? It can be actually a bad infection. You can affect the lung. I had seen chickenpox pneumonia, varicella pneumonia happening to a 16-year-old girl. So it is actually bad, and vaccine is preventing this at least severe disease, a symptomatic disease, not only severe, symptomatic disease, almost 90 to 95%. So just go ahead if you do for your vaccination and talk to your doctor, talk to your ID doctor, or talk to your physician if you are comfortable with somebody, that what all the vaccines are to be taken based on the risk factors that you have, or based on the condition, geographical location that you are residing, what vaccines should be taken by me. And these vaccine preventable diseases should actually be prevented. As we are seeing that, yes, what we are seeing, COVID vaccine is new, but COVID, after the vaccination, the scenario in India has changed. It is not that we are not getting COVID infection, but we are not, I am seeing cases, but people are not getting COVID pneumonia now. They are getting mild infection, high fever also 2 to 3 days, but it is subsiding. The scenario in our country has changed. So vaccination plays actually good role. It doesn't say that vaccine is going to be 100%, but yes, vaccine can definitely prevent you getting a severe or a bad disease. If it is taken on time, well before time, then you catch infection. So for flu vaccine, the time is there. Go and get your flu shot. So these are the basic steps of doing hand rub or a hand wash. So it's a 6-step that we see. First step, 6 step of what we do actually during hand hygiene. So rubbing hand palm to palm, then rubbing back of the hand in between fingers. This is interlocking your fingers, then your thumb, then your fingernails, both sides. just clear it up to the wrist and your hands are disinfected. So if you properly do it, it takes around 20 to 30 seconds that a proper hand procedure is done for proper hand hygiene. And this is what is recommended. So even if you are using a sanitizer, do it properly because there are commonly missed areas. So if you don't do it, this part is actually missed of getting disinfection, and you can still transmit infection. So what is the point if you are not doing if you are just sanitizing your hand thinking that yes, I have decontaminated my hand, it is disinfected now, and you are touching carelessly your elderly family member who is actually bedridden, thinking that it is to sanitize your hand properly. So just rubbing alcohol hand swab will not work. 20 to 30 seconds of sanitizer properly done will make your hand clean. So, and pet care. Yeah. So if you have a pet, watch for any infestations, watch for any illness, and watch for any scratches. So all these things are important. Pets, sometimes they carry certain ticks or mite, small I can say insects over their hair. So you have to be careful that it is not there. I have seen patients who come to me that they develop some allergic problem, some cough is there. And when carefully taking that, they mentioned that they got the dog like 6 months back, and after like 10-15 days, they started having this problem there. So you have to be careful. If anything is there, get your pet checked also routinely. Pet vaccination is also there. A veterinary doctor can guide you about this, but pet care, overall pet hygiene and being watchful for the insects over the pet hairs. Just be careful. Watch for any scratches. If any micro scratches are there by the pet, just keep a check. It's not only about rabies, because there are other infections also, especially with the cats. I had seen cases of cat scratch disease that had come to me. She was a resident of US. She was residing in Delhi and was a cat loving person. And she had multiple cats, came to me with a swollen lymph nodes. There was multiple lymph nodes and rashes, on and off rashes last 3 months. And in the careful history, I found this was there, and during workup, this was proven. So yes, any scratches by your pet, just don't ignore it. Take care of this, and whenever you're meeting your doctor, if you are finding any abnormal signs or symptoms of after that, just mention your doctor about this, because certain infection they can transmit, and we don't have a vaccine for it for your pet. So it's only the hygiene part that is actually important. So now what do you do in case somebody gets infection in real sense? So yes, contact your doctor. Good hygiene practices. So if somebody is infected at home, first thing, isolate yourself. I'm talking about viral infection. Isolate yourself. Isolate yourself. If somebody is coming in your room, wear proper mask. So this holds true for both viral like COVID or flu virus, because both transmission is same. Wear a mask. If somebody is entering, he or she should also be wearing the mask. So mask will actually protect you from transmitting the infection to others if the patient who is infected is wearing mask. So this is most important. It's not the person who is entering is always required to wear the mask, but the person, if somebody is infected, is wearing the mask. This is the most important part to decrease the chances of getting infection. Take your medicines on time. And the good thing about infections are they are treatable. Diagnosis and treatment needs to be correct and appropriate for the treatment. So for further queries, you can contact on this number, or you can contact Jesse Hospital also. Thank you. So I can take questions now. Yeah.
Yes, doctor. Am I audible?
Yeah, very well.
Okay. Just give me a moment. I'm going to spotlight myself too. Yeah. So thank you, Dr. Ankita. Actually, there was a lot of eye-openers for me as well. So we'll quickly take a few questions that we had received. So I'm just going to go in any particular order. How to keep routine intake strong to not get affected with infections around routine intake, how to introduce or give to senior citizens if they deny to have. So, with what other dish we can mix and offer?
So
Very
first
awesome.
thing, routine intake, you need to repeat the question, Jacinta. I was actually looking in the chat, but I could not find it. Yeah, please.
Going ahead. So, how to keep routine intake strong to not get affected with infections,
Hmm.
and how to introduce or give, I think, these kind of routine intakes to senior citizens, and if they're denying to have it, so what other dish we could mix and offer to them?
So, so you have to be actually very clever when it comes to all regards to everyone here. So, when sometimes I had seen senior citizens, especially after 80, they can behave like a child, that they are not taking proper supplements, they don't want to take their medicines. So what they can do is, in their meal only they can mix up. I had seen my patients only tell me this, that they are doing this, that in the wheat flour they are mixing some paneer water, and they are mixing some vegetable puree in it during making the dough, for so that actually they are getting nutrition. Supplements are actually good idea, because what happens, the diet, when we grow old, our diet become less, they tend to eat less, and the nutritional value actually suffer. So only and fruits and vegetables, they actually are rich in antioxidants. So if they are not consuming it properly, so you can give it in the form of supplements, but make sure you are changing these supplements almost 1 to 2 months every time. Consult your doctor about this, which supplement will be good, because sometimes what happens, if we take one supplement only for a very longer period, you see, each supplement, each capsule has some 8 to 10 micronutrients, right? So you are taking it for a very long period. So what you are doing, you are actually taking a lot of those micronutrients, but you are making your body deficient for some other micronutrients. So try to take different combinations every month or 2 months. You would switch between different combinations. Talk to your doctor. He or she, your doctor can advise you which supplement according to your body need is required.
Okay, thank you, doctor. I think this is just a statement, but nevertheless, I should. So, my husband has had 3 surgeries. He is 81. I've been taking care, so she's a caregiver of him for the last 30 months. He sleeps 2 to 3 hours at night. Uh, there's no question, but we can surmise that I think the complaint would be of the 2 to 3 hours sleep at
Sleep.
night. 81-year-old has had 3 surgeries. For the last 30 months is being taken care
So
of. And yeah,
first thing, Jacinta, it is required to see that there is no as such problem, uh, as such problem in her husband, apart from the age, the multiple things that has happened. If it is just a psychological thing, age-related thing, that he's sleeping 2 to 3 hours only, then that is okay. But there are other medical conditions also related to it. Uh, Sometimes liver dysfunction can be a cause of this. So he should be checked by a doctor, that there is absolutely other parameters are overall okay, and there is no medical
correct.
reason for this, and it's just a psychological or behavioral thing, then it can
True.
be taken care by the counseling, and sometimes little support of sedatives.
True. Absolutely. Thank you. I think you've covered this, but nevertheless, how important it is to take flu shots. You mentioned it is pretty much key. And are tests for all vitamins enough to determine immunity?
No, it's not there. So immunity, first thing, immunity is not built in a day. So it's a gradual process. So every day, your daily lifestyle actually helps you to get a good immunity. So that includes diet is a part. Your overall sleep hygiene is another part. That you are taking a good 6 to 7 hours sleep. This is important for overall metabolism of the body to be healthy and have a good immunity. Practicing regular exercises again helps in building immunity and immunity. So all these things, diet, sleep, and your exercise, all three helps in building immunity. Just if you have a normal vitamin level do form an important part, especially I can say vitamin D level, especially in COVID era. Vitamin D is actually also acting as an immunomodulator in our body, helps to keep our immunity strong. So vitamin D, a lot of research is there in Mycobacterium tuberculosis also, TB, infection prevention. And also during treatment, now we are supplementing vitamin D. So this is this is vitamin D is important. If that level has to be checked, if it is less, it should be corrected. But if I say that vitamin level is normal and you have a very good immunity, that will be a wrong statement from my end. So immunity cannot be assessed as such by, there is no as such direct parameter where we can assess the immunity. Only when somebody gets infection, like a person X in the family, you must have noticed somebody had a very bad COVID, somebody had a normal COVID, somebody gets a symptomatic flu infection, somebody gets a no symptoms at all. Flu is such infectious that we say the incubation period is only 24 hours in that case, only 1 day. So it is so infectious and it presents so early. So if somebody in the family is having flu, but others, somebody is having no symptom, this makes that the person is having a good immunity against that infection.
So you're saying at particular there are no tests that can give you based on vitamins at least that you are completely high immunity.
So we do certain immunodeficiency tests to check whether there is some sort of immune deficiency leading to certain infections. But to say that your immunity is very good based on certain tests, we don't have right now anywhere in the world for that test. Yeah.
Okay. Very subjective question, but long-term plan for patients with Parkinson's. Possibly.
Okay. So see, Parkinson's, the problem is slowness of things that happens in Parkinson's. So it's a neurological disorder, usually age related. Sometimes with aging, few people get the Parkinson's disease. So because of the slowing, first thing is tremors. The tremors in the hand, difficulty in holding your maybe spoon or cup or glass of water. So little support is required. There are different medicines that can delay the progress of Parkinson's. We don't have right now any treatment for these neurological disorder, but yes, the delay is there. Neurologist help can be taken for Parkinson's disease. And in general, for a caregiver, what you can help is that try to, if somebody is having a significant debilitation because of Parkinson's disease, try to avoid sharp things around, because he or she is going to have tremors in the hand. So if somebody is having sharp things around him, he or she can get hurt. So that should be there. Drinking water or taking food should always be supported by somebody. Somebody should be there to take care of that, because at significant involvement with the Parkinson's disease, there are chances all these daily activities are hampered. But early address to the problem, and early in what we see in the early phase of illness, people start having tremors in hand, slowing of gait is there. We call it Parkinson's gait. They slowly they're walking. So slow stepping gait is there. So these type of, if you're noticing, talk to your doctor, talk to your neurologist for early support of medication, so that delay of progression is there in this disease.
The next question. I'm told that chances of a senior or an older adult developing pressure ulcers, bed sores, is 5 times more after a week of hospitalization. Do you agree? And how can this be addressed?
See, Jacinta, like about this times thing, 5 times or 10 times, different research paper will tell you different numbers. So yes, pressure sores are actually a problem with people who are bed bound. Elderly tend to develop pressure sores more early than the people who are young, because of the less muscle mass between bone and the skin soft tissue. So that is how it is there. They develop more commonly. You can prevent it. I have already mentioned that using water and air bed, frequent positional change, keeping your skin dry there. And if at all, if I just started, the skin start peeling, getting drying up and peeling off. This is the first stage. And it is non-infected. Early when non-infected. So then simple dressing and putting a Mepilex bandage there actually helps in early healing of that, and it doesn't progress. So when the bed sores get infected, then it becomes a challenge for regular dressing, debridement, and it actually becomes a challenge. So earlier it is taken care of, and frequent positioning change will prevent the formation of bed sores.
Doctor, you mentioned covering of the bed sore at stage 1, even early, very early stage. What do you cover that? What is exactly the
Mepilex dressing. It's called Mepilex dressing. It's a
okay.
pink color dressing commercially available for
Okay.
especially for the bed sores.
Okay. What quantity the thought? I thought this should not ever be covered. Like we usually have this thing when you have bruise, it should not be covered. You should air it out. Okay. I was
So
quite
what,
surprised.
see, pressure source, usually, even if you try maximum, na, that it gets air out. So this is not possible, and minor trauma also, it will peel the skin more frequent, more there.
Okay.
So what it is to be done, that this Mepilex dressing, if it is applied, it is a little, I can say, sponge like also. Then it will get relief of the pressure. It has to be changed regularly, every time, every day. So every day it is changed a little, the area is dried, it is disinfected, and then dressing it put. And then again, you are taking the same precautions. Water mattress is there or air mattress is there, frequent changing of the patient's position. This will not progress further.
Okay.
And once it is healed, you can take off the dressing.
Okay. Okay. Sam, you raised your hand. Would you like to ask your question?
Yes, yes,
Yeah.
if you don't mind. Thank you, Dr. Ankita. That was a really informative talk. Just wanted to know, I was the one who raised that question about the pressure ulcers. So I have a lot of experience in caregiving to bedridden patients. So bed sores is something that I face on almost on a daily basis. So what I wanted to know was, you mentioned that this dressing that you mentioned about is good, is definitely a suggestion. But what I wanted to know was, if the skin becomes dry, it will cause itching, right? Normal tendency for skin is when it becomes dry, it becomes itchy. So the patient tends to, even unconsciously scratch. And that's when the skin can more easily break up, because we know that skin is already compromised. So I was wondering whether extra moisture in that area could help, because I found that to be useful. What do you think about that?
See, actually, so we recommend that the area should be dry. We don't allow moisture to be there.
Moisture in the sense, I'm not talking about wet moisture. I'm talking with the help of a cream, maybe some kind of oil-based thing.
Or you can just use sometimes a neomycin ointment or fusidin ointment that can be applied locally, that area, but it should be not a typical moisture as such.
Okay.
There, it should not be a wet area, but a little antiseptic or emollient can be applied. That is okay.
Okay. The dressing that you mentioned would probably provide that moisture that is needed. Am I right?
And it will also relieve the pressure from that, and minimal trauma is also relieved. I had seen people especially in the ICU there, getting pressure sores over heels. So they're using sometimes gloves or a small balloon at home, a balloon if it is available, with a little water filled there, that to relieve the pressure. So all the idea is that the pressure should be relieved, and frequent changing will help in that.
Okay. Okay. I think this time is too short to really, I don't want to hog your time. Thank you so much. Maybe I'll get in touch with you for more information. Thanks.
Thank you. Take care.
Doctor, okay, so doctor, would you be able to type, Padmini's helped us, the name of the dressing, Mabilex, if you could just type it in the chat so that...
Mepilex dressing.
Mepilex. I hope everybody and Padmini particularly, you've got that. Thank you. Quickly moving on. Doctor, maybe in specifics, any suggestion for supplements that caregivers can take to keep healthy? Oh, okay. This is a question for caregivers themselves. Okay.
Yes.
All right. Maybe you can answer for both the patient and the caregiver, I guess.
So see, I'll not take particular brand name on this forum, but you can go ahead with omega-3 fatty acids, vitamin E, lycopene like combinations. Apart from this, micronutrients like having zinc in optimal amount, so not 50 micro mg of zinc as it was recommended in COVID. Even 5 to 10 mg of zinc is fine. Selenium is another important micronutrient and important antioxidant. So these 4 or 5 ingredients that I have mentioned, you can see in whatever supplement you are taking, that if these are there, they're actually helpful and as actually powerful antioxidant that can be taken on a regular basis. But again, not for a very continuous, very long time. It should be changed in between the supplement combinations.
Doctor, do you think these supplements should be obviously in tandem with your consultant, with the doctor?
Yes.
Because
Should be,
maybe
because sometimes there are certain things, like if somebody is having a renal stone, we don't advise them to take calcium tablets.
Correct.
So which you take a medical advice, which supplements, what combination should be taken, and accordingly you can switch between this thing.
Correct.
Supplements.
There's a question on the chat by Lorraine. Any tips, I guess she's asking, for cleaning of the urinary pot?
Okay. A normal soap and water disinfection will suffice for cleaning a urinary pot.
I hope, Lorraine, you're using that.
It doesn't clean up. It gets all yellowish, like sediments.
See, for the disinfection, soap and water is all fine for a urine pot, but I have never come across that any other particular chemical that is used for cleaning for urinary pot for removing this yellow stains. So for disinfection, soap and water disinfection is fine for urinary pot.
Okay, and secondly, for diabetic patients, another question. Diabetic patients, the webs between the toes and all start stinking a little bit. So even that candid powder does not suffice for it. So what should be done?
See, there are 2 things in diabetes. One, it could be sometimes if it is stinking a lot, it could be an anaerobic infection also. So it might not be always a fungal infection. In fact, I got few patients, elderly, who were taking Augmentin. So it's a different scenario. Who were taking Augmentin, that thinking that it is a bacterial infection, but when they came to me, I saw it was a fungal infection. It was itchy as such. So it is important that it has to be examined what kind of infection it is. If it is a fungal, candid powder or a candid cream, or sometimes terbinafine cream suffice for this fungal infections. But if it is an anaerobic, because diabetes, anaerobic infections are very commonly seen. So then we require a clindamycin tablet or a ointment which is rich in clindamycin. So there are different ointments available in the market with clindamycin supplementation in it. So that can be used, but it has to be examined by a doctor. Otherwise, diabetic foot is really a bad disease to happen into anyone.
Okay. I'll also make an announcement while we're in between the question, just a couple of more left. So doctor has provided her number, I think at the end of a presentation. I can give that again, doctor. And this is something that I have actually approached doctor more than coming the other way around. So those who are attending this session, both from caregiver Sati community or the Jassi hospitals, or even if you're not in any, are open to an online consultation. If you're in Delhi, you can meet doctor, because doctor sits in Delhi. But otherwise, online consultation till about a week, till next Wednesday, doctor is happy to consult you online on any of a follow-up with patients, etc. And she's happy. I'm happy that we'll have that at a discounted consultation cost. Yes, something. Yeah.
Just like doctor doctor, have you tried this Duoderm anytime? It's by Convatec.
I just see what the composition is. This.
Okay.
It's again Duoderm. Yeah, this is also same.
Yeah.
This is also same.
It was quite effective actually with a few patients that I tried it with.
Yeah. This is same. This is same.
Okay. Thanks.
Yeah.
Okay, the last few questions are: what are the most common infectious diseases? Maybe you could summarize again. I think you covered in the
Actually, most common infectious diseases. So in general, if I talk about which body part is involved, it is URTI these days, what we are getting more frequently. Currently, URTI means cough and cold, sore throat, because a lot of viral is going on. And also a lot of cases of, right now I'm getting typhoid, dengue in Delhi, dengue also, typhoid and gastroenteritis. The monsoon season, food and waterborne infections are actually high. And one reason I have mentioned about that, people taking antacids actually increases the chances of getting infection if they are taking antacids on a regular basis.
And Doctor, about these flu shots, can we just, they say over the counter, can we directly go and ask for a flu shot, or should we again consult our doctor before taking flu shots for any age?
See, flu shot should not be taken in a chemist shop. It will be done in any nursing home or a clinic only, or in a hospital. So for that, if somebody is having a ongoing fever or any symptom because of which it is not recommended, so most commonly it is fever. If somebody is having current fever, he or she should not go for vaccination. Apart from this, there is no usual contraindication. For COVID vaccine and flu vaccine, there has to be 2-week gap at least, because these two vaccines have never been studied simultaneously कि एक साथ दोनों आर्म्स में लगे हैं, ऐसा नहीं हुआ है. So flu vaccine over the counter तो नहीं लगता है. You have to go to a clinic or a nursing home to get it done, or a hospital to get it done.
Okay.
It's under medical supervision only.
Okay, got it. Doctor, before that, I think the lady who had just asked for her patient, the diabetes with the ointment name is what she's requesting. If is it possible to put it? Lorraine.
So basically, I just saw. So
Lorraine Jones.
Sorry, this question, clotting suddenly at feet area, no pain at area at all. So patient does not remember. So there could be some trauma, or if at all there was no history of trauma, then it needs to be checked. What is the platelet level? What are the other clotting parameters of the blood? We call it PT-INR and APTT. If any blood thinners are ongoing, so all these needs to be checked. If somebody have a sudden clotting, clotting means, I think you want to say there is a bluish patch on the skin. This is what I understand. Clotting ऐसे पता नहीं चलेगा कि आपके feet में clotting हो गई है और वहाँ कोई pain नहीं है. It's usually in the form of bruise. So it's not the clotting, it is actually a slight bleeding that happens there. Clotting में तो ये होगा कि pulse कम आएगी, swelling हो जाती है अगर vein में clotting है तो. So that's entirely a different presentation in that case.
So Yogi, I hope your question is answered. Yeah. And Dr. Lorraine, before this, she was asking for that ointment, the name of the ointment for her swelling and bruise.
Name of the ointment? For swelling, I think he has, for that pressure source area, for the moist, to keep the area little moist, he can use Fusidin ointment, or maybe Neosporin ointment can be used. Okay.
And doctor, the last question on that we got earlier, is there a medical solution to bladder incontinence?
So yes, there are certain medicines that is there, that is available to help for the bladder incontinence. There are different sort of incontinence again. So stress incontinence, urge incontinence. So depending upon what kind of feature, it actually comes through the history that we take. कि किस तरह का है, and stress incontinence could be somebody is having coughing, and during that there is a urinary incontinence, then that becomes a different thing. Somebody is having urge to pass urine, and while going to washroom again, he or she is not able to hold urine properly, then that's an urge incontinence. So depending upon what kind of incontinence is there, actually there are different medication, different group of medication that is there, and most suitable one is given. Elderly male, usually sometimes because of the prostate enlargement, they have a different sort of incontinence, dribbling of urine. So in that case, this thing, a medicine that is actually helping in the prostate enlargement management also, that is also attached to it. Usually a urologist take care of this.
Okay.
Yeah.
Okay. So if there are no any further questions, Dr. Ankita, if you can finally,
Thank
I
you.
think your contact is there, and I have also placed Jesse Hospital's contact.
That's right.
So anybody who can connect with me are open
This
to
is
consult.
my staff number. I'm just putting the
Sure.
coordinator's number here on the chat
Sure.
only, so you can circulate it.
Thank you.
Okay. Okay. Have a nice
So,
day.
Doctor,
Evening.
thank you so much for your time. I think there was a very healthy information, question, answers. I hope it has addressed, and we're looking to having a different topic again with you. Thank you, Doctor, for your time. And
Thank you.
And that's the
Have
caregiver
a nice
Sati
evening.
link.
Okay. Thank you. Thank you.
Thank
Bye.
you. Good night, everybody. Bye-bye.
Thank you
We
so
should
much.
reach out to you separately. Bye-bye. Thank you.
Thank you.
Thank you. Thank you.
Thanks for putting it together. That was a
Thank
very
you.
informative session.
Thank you for
Very-
joining.
We
You're
need to
taking your
talk.
time out.
We need to talk to you. Jessica.
Very informative it was. Yes.
Yes.
Thank
Thank you for taking the charge, we are just organizers, but you participate and make this whole. So kudos to each one of you, and I wish each of your loved ones good care and good health. Take care. Take care, everybody. Bye. With love.
Thank you.
Bye.